All right. Good morning, everyone. Thank you for joining us again today for our monthly stakeholder meeting. We have more updates for you all today on sort of where we stand and all the priorities that Team Kentucky is focusing on. We will be having Senior Deputy Commissioner Veronica Judy Cecil present to us today. Very excited to have her as she is the queen of all things unwinding, in my opinion. So very happy to have her. We will be turning it over in just a second, but I just want to let you know all mics and are muted for this meeting, but we are monitoring the chat in case you all have questions and we have time to flag that at the end of the session today. So please feel free to chat anything in. We will get to them at the end of the meeting. And then as per usual, this is being recorded and the slides and the recording link will be up on the PHE website. So always encourage you all to check out that website for up-to-date information. And this will be up in the following days. So thank you so much. And with that, I can go ahead and turn it over to you, Senior Deputy Commissioner. So take it away.
Thank you, Helen. Good morning, everyone. I just want to apologize up front. I've got a cold, and so it's causing me to have to cough a little bit. So I might have to take a drink here and there, but appreciate you being with us this morning. We're excited to share some really great information, and we'll just dive right in. And I'm going to turn off my video while I show the slides, but I'll come back on following the presentation. Okay. We always level set talking about the public health emergency unwinding. As you know, states were required to start reinstating the renewal process. In Kentucky, we started that with renewals in May, and we go through April of 2024 as part of our unwinding period. Just another thing to note that we've talked about at the beginning of unwinding, but just to, we always want to remind folks the enhanced federal match that we've been receiving to help us offset a lot of the costs that came with the continuous enrollment is phasing out and will be ending on December 31st. And so that's another reason why it is important that we go through ensuring that, only those eligible for Medicaid are still covered, and one of the reasons why this is an important process. But I am jumping to flexibilities first, and usually we don't do that, but there's some really great things we want to share, some important information that we want everyone to know about. The flexibilities and we also call them strategies, or the things that we're able to do as a state to try to help us through the unwinding period. It's to help with workforce, workload, and so there are various flexibilities that we've implemented since the start of the renewals. And the whole list is out there on our flexibility tracker on the website, but a couple of new ones I wanted to point out to you all. In the top left there, you'll see suspend child renewals. What we're doing, starting with October and going through April, the end of the unwinding period, is that if there is a child under the age of 19 who has a renewal, we are going to automatically extend them for 12 months and grant them continuous coverage. In April, as we started unwinding, Kentucky did implement continuous coverage for children. What that is if a child is determined eligible, then we grant them 12 months continuous coverage. And during that 12-month period, the only reasons why a child may lose their coverage is because they turned 19, they moved out of state, they had a parent or guardian request that they be disenrolled from the Medicaid program, or of course, if the child passes away. So those are the only 4 reasons why a child might lose coverage during that continuous coverage period. If there's a change in circumstance, like an income, we won't process that. If there's a change in circumstance related to their category eligibility, We've talked about categorical eligibility a lot, and I think people are starting to understand that sometimes because of just who the person is, they're granted automatically eligibility in Medicaid. A good example of this is a foster child is granted eligibility for Medicaid because they're in that category of a foster child. So if somebody loses that category eligibility, they will still continue to be enrolled during that entire 12-month coverage. At the end of that period, then the person does have to go through a renewal and does have to reapply for other coverage. But again, during that 12 months, it's guaranteed. So we're taking that new eligibility that we have in Kentucky, and we're going to leverage that from October to April. And instead of requiring the child to go through the renewal, however, again, we're just going to automatically grant that 12-month period. On the top right, you'll see redistribute December renewals. So what we've decided to do is take the majority, not all, but the majority of the December renewals, so those who had a December 31st renewal date, and redistribute them through the rest of the unwinding period. Primarily February, March, and April, some in January, but we are doing that to help with workload and some workforce issues to give some time to catch up on a lot of the pending actions. We're seeing not just renewals having a bit of a backlog, but applications as well. So we want to give our workforce some opportunity to catch up. So when I say that not all renewals, there are going to still be cases of renewals in December. If a Medicaid renewal is aligned to another program, we've talked before about the fact that someone might have Medicaid and SNAP, and we've aligned those two programs to the same renewal date so that the eligibility worker only has to touch that case once. So if the December Medicaid renewal is aligned to another program's renewal in December, they're going to still stay in December. And if they are determined ineligible, they will be disenrolled. So you will still see some terminations as a result of December renewals too. The caveat to that is children. So if a child is part of that case, then the child will automatically receive the 12-month coverage, and the adult in the case, if there is one, is who would be disenrolled. So we are still applying the suspending child renewal for those cases. We're also going to go ahead and you'll see we'll have a caseload in December where we're going to go ahead and try to passively renew those individuals. You will recall passive renewal is where we go out, we ping the federal hub and a whole bunch of databases to verify income and assets. And we are able to determine that somebody is eligible based on that credible information. And that means the individual has to do nothing for their renewal. We will automatically then renew them and move them 12 months to the next renewal date. So if we're allowed to passively renew a case in December, we're going to go ahead and do that. They'll get that notice of eligibility, granting them eligibility. If somebody cannot passively renew, then we will take that case and redistribute it as we're doing with several of the other cases. So somebody is not going to get a notice that they have a December renewal if they cannot pass that passive renewal. So those cases will be redistributed also. And then lastly, if a case, though, does go out for passive renewal and we are able to verify that they are no longer eligible for Medicaid, but eligible for a qualified health plan and an advanced premium tax credit, you recall that tax credit makes that qualified health plan premium either no cost or low cost. We will go ahead and transition that person over to the exchange to choose a qualified health plan. So that those activities will still occur. So again, you'll still see some December renewals that will be approved and terminated in December, but it'll be a very, very small number. The other thing I want to mention, since the last time I believe that we spoke last month, bottom left, the extensions for all populations. So previously we had extensions for long-term care and waiver members. And we had up to 2 months for them. Excuse me, one moment. What we have decided to do is also extend for 1 month all the non-long-term care and non-waiver members. So if we get to the end of the renewal month and the person has not responded to a notice, we can grant them a 1-month extension. So they'll be moved to the next month and given that additional time for us to conduct outreach and for that person to submit the and respond to the notice. That includes a request for information or a renewal application, or excuse me, a renewal notice, renewal packet. We did, again, I mentioned we had a 2-month extension for long-term care and waiver members. We have now extended that an additional month so they can have up to 3 months extensions. So that means that it moves from month to month. So for example, if somebody in September, long-term care 1915C waiver member didn't respond, we can move them up to October. If they didn't respond in October, we can move them to November. But we cannot exceed that 3 months extension. So going back to December renewals, if there's an extended renewal in December, that is also another case that we can't go and extend. Either the member may still be procedurally terminated if they haven't responded. Okay, sorry, I got these out of order. But so the next thing I want to talk about in terms of flexibility is Appendix K for our home and community-based 1915C waivers. Appendix K is the vehicle in which we've been able to extend flexibilities to the waivers. And so they've had a different termination date, and that date was November 11th. Prior to November 11th, we received communications from CMS about how we extend any flexibility that's in Appendix K beyond November 11th. And the way that we had to do that was to amend all 6 of the waivers, add in the flexibilities we want to continue, and then file those, submit those to CMS and have them submitted prior to November 11th. Our team was amazing. They were able to get all 6 waivers updated, do the public comment, review the public comments, and then get those submitted in a very short time frame. So those are now pending with CMS, the Centers for Medicare and Medicaid Services. Once CMS is able to review those, then we'll be able to at some point permanently implement some of those flexibilities that we've been able to have under the public health emergency. Here are those flexibilities that we're planning to make permanent. As you can see, there's 7 primary ones. The rate increases are one that I think most are interested in. We are able to maintain those rate increases while those waivers are pending, and then we've made requests for permanent increases going forward. We're expanding case management, provider qualifications, reducing the age for respite personal assistance and attendant care and residential staff from 21 to 18. I'm not going to go through all of these. They'll be on the slide, but just wanted to share what's happening in that area. And there will still continue to be, there's a separate stakeholder group and communication around the HCBS Appendix K. So just continue to look for those opportunities to learn more about what's happening. So not unsurprising, we did anticipate that we would see a drop in enrollment for Medicaid as we started renewals. And so we are seeing the trend down. I think what's most important to us is that a person is actually determined and eligible. We are trying to reduce the number of those who, again, we call procedurally terminated, so they didn't respond to a notice. We're trying to, prevent those, but unfortunately, they do still happen, although the number is decreasing. So we are 6 months into renewals. Hard to believe. Of course, November, we're processing November's right now. November will be at the end of the month. But this is just a snapshot of the CMS monthly report. That's the report we file on the 8th of every month for the previous reporting period. So for example, on or by November 8th, we filed with CMS all of the activities that happened with those who had an October renewal. Those are on our website. We always post them as soon as we've submitted them. So sometime around the 8th or thereafter, you can go out and see what the CMS monthly report is. It also breaks down how many are approved through that ex parte or passive renewal, and how many have been determined ineligible. So it got some great information. But just looking at October, our most recent month, we did have a little over 155,000 individual renewals, and we were able to approve 89,854. That's a nice large number. We were happy to see that. We did terminate 12,613. Of October renewals, we had 2,852 pending. Pending means that there is processing still ongoing for that case. So if somebody's responded to a notice and the state hasn't taken action on it and we cross that renewal date, then we do pin the termination and until the state can complete that review. So we have a little over 2,800 pending processing. And then you'll see our extended bucket has increased from month to month, and definitely in these last couple of months because we have been utilizing those opportunities to extend the long-term care 1915C and now all populations for a month or up to 3 months. I shared with you last month our new demographic report. And so September's is out there, I believe, on our website, and we've just completed October. This is a great way for us just to step back and look at the population and who really is being impacted. You can see it shows race, ethnicity, gender, and age. And then the report itself breaks down approvals and terminations by county. So you can go out and look at each county and the rates there. It also kind of helps us just do some level setting on, where are we seeing a high number, and we look at the procedural terminations specifically so we can see if is there something else we need to try to do for outreach in those areas. Though we have a lot of flexibilities around children, you're going to still see some terminations, but we are ensuring that we're applying all the flexibilities. What can sometimes happen, because some of the flexibilities are manual, that a child may terminate, but we'll put them back on and make them aware of the fact that they've been reinstated, because for some reason the system was unable to catch them. So we're scrutinizing all of the child terminations. We get a list, and we're scrutinizing it to make sure that we aren't inappropriately terminating a child. So when you see child termination, it really is because there's a reason why we're not able to extend that eligibility, such as turning 19, or they've been requested to be disenrolled, or they've moved out of state. Those are the three primary reasons. So I mentioned reinstatement. One of the other flexibilities is that if somebody's been procedurally terminated and within 90 days past that termination, they provide the information and we're able to make a determination of eligibility, they can be reinstated back to their date of termination. And this should be automatic. I believe that we've tried to really make sure eligibility workers understand that this isn't something they have to ask for, but just always trying to make sure everyone's educated that that is an option available. So if somebody walks into the doctor's office and has just been terminated and has been terminated within the last 90 days, always encourage that individual to try to go and respond to that notice, so that they can possibly be determined eligible and reinstated. But we're tracking those. Of course, May renewals are now done, and June renewals are now done, but still tracking October through July. And it's November 16th, so we're 16 days into after the October renewals terminated, and we've already got 1,600, almost 1,700 individuals that have been reinstated. So we're always glad to see that number increase as well. I mentioned the fact that we're extending folks in the December redistribution. So we wanted to show the new projected cases as part of that redistribution plan. And you'll see that the December, we do still have some cases in December, but we will see fewer terminations. Mostly there'll be approvals. So we'll track that number, but to do that, we did have to redistribute the rest of the cases. And we've redistributed cases for various reasons. Some might be for the child extension that we had originally implemented, but a lot of these are the redistribution of December. We always like to focus what our priorities are, and so this has been, a lot of these are the same. And that is just because these are just reminders. Please respond to notices. Encourage members to respond to notice, even if they believe they're no longer eligible. We really want to ensure that what we're doing is determining somebody's eligibility. So still encouraging folks to return that even if they're not. And to come back in those 90 days. So if somebody's been terminated, encouraging them to respond to that notice, trying to come back in. And right now we're really focused on implementing all those strategies and flexibilities so that we can reduce the number of procedural terminations. We've talked a lot about outreach. I think I've mentioned definitely in the early time of unwinding that the state itself, so the state is contacting individuals that have an active renewal, so they have to respond to a request for information or to a renewal packet. They have to provide us some kind of verification or information that we're contacting them about 3 times before the end of their renewal period. So we contact them when the renewal notice is going out. We contact them a couple of weeks later if they've not responded, and then we contact them about 2 weeks before the end of the month of their renewal if they've not responded. But the MCOs, the managed care organizations, are also doing a lot of outreach to their members. And we've been starting to track that just to get an idea of not only what the state's doing, but what the individual managed care organizations are doing. And as you can see, this is just September. So the number of outreaches that they've done, so either call, email, or text, you can see that that's a large number. And so just trying to reinforce that we're doing what we can to try to reach individuals that are going through a renewal so that they understand what to do. And then just a reminder that we did give permission for managed care organizations to actually help somebody through the renewal process. We gave managed care organizations the tools to do that, They have a training guide and also a training video that we've provided to them so that they know if they can help that member navigate the process. We're hoping that that also continues to increase the number of individuals who respond to notices. So now I'm going to talk a little bit about the communication materials that are out there. This one may look familiar, but we always like to promote it. We do have lots of flyers and other materials for the various stakeholders. If you're a provider or an advocate, we do have lots of materials out there and lots of flyers. We ask that you post so when somebody, a Medicaid member comes in, it just is reminding them that we're going through renewal. We've done what we can to try to get that word out, but can't reach everybody through all the normal routes of communication. So just trying to reach people where they are. So if they come into your office, if you see them, if you interact with them, if you can share the information, that's always helpful. We've got a new material called reinstatement information. We heard a lot about people not really understanding how to navigate that reinstatement process. So we put this together. Also, if somebody comes in, you can hand this to them if they're in that reinstatement window because they've just been terminated. This is hopefully good information. I always say at this point that we are always working on new and improvements to the communications. So if there is something else that's needed, if you think we can tweak what we have for better understanding, we're always open to that feedback and certainly hope that you'll take the opportunity to provide that to us. The other thing we're working on right now that we hope to be able to release in the very near future is a flyer on how to navigate identity proofing and the creation of a Connect account. We hear a lot of challenges with navigating the identity proofing process. So we are creating some materials specific to that. And again, just really appreciate everyone pulling that down and helping a member that might be trying to navigate that process. Always just trying to remind folks and have it easily available as to the ways to respond to a notice because there are multiple ways. One is that Connect account, so encouraging members to create an account and use that as the communication tool to provide the documentation or verification that's needed for a renewal. It's the quickest and easiest way for our eligibility workers to pull down and do a determination. But you can still do it by fax or by mail. Of course, you could walk into a DCBS office. We have our amazing connectors and insurance agents across the state that are there and willing and able to assist members as they're navigating the renewal or application process. So links to those are available to find one in a local community. This is always just a reminder to any new provider on the meeting that we have added the redetermination date to Kentucky Health Net, which is the system that our providers utilize to check on eligibility for a member. So we always ask that a provider check that, and if they especially if they have a person coming in for an appointment, to have that conversation and reminder to them that they've got an upcoming redetermination. And then for our long-term care and 1915C waiver providers in our Kentucky level of care system clocks, there's also a renewal report that we're able to pull out that can show them when their patient's renewal is coming up. And then for our connectors and agents, we do have regular meetings. Just a reminder to when those are for those folks that are on the call today. And also just a reminder that there is an escalation process. We understand, we have to do our best to try to process cases in the order which they are received, but there are dire needs out there. We fully recognize that. And we want to know when there are those dire needs, and we want to escalate those cases so that we can get that member's case processed. So I showed you the trend going down for enrollment in Medicaid, but what's great to see is the trend going up for qualified health plans. So as individuals aren't eligible for Medicaid based on income, but they have an income that makes them qualified health plan and advanced premium tax credit eligible, we want to see them move over, choose a plan, and get that coverage started, hopefully with no gap in their coverage. So this is continuing to tick up, and we're really happy to see that. We are in an open enrollment for qualified health plans. So unlike Medicaid, where Medicaid is a continuous open enrollment, you don't have to you can apply anytime. It doesn't matter about a qualifying life event or just anytime you can apply for Medicaid year round. But for qualified health plan enrollment there's a window. And so it's now open through January 16th, 2024. Our contact center has added Saturday hours to accommodate open enrollment for a qualified health plan. So now they're open from 8 to 5. Our DCBS contact center is always open on Saturdays from 9 to 2, but now you have those extra Saturday hours for enrolling in a qualified health plan. Just a reminder that after that QHP open enrollment period, there is always a special enrollment with any qualifying life event. So after January 16th, someone could still enroll in a qualified health plan if they have one of those qualifying life events. And then for the Medicaid unwinding, there is that unwinding special enrollment period. It began on March 31st, 2023, and runs through July 31st, 2024. What's interesting about this special enrollment period is that at any time that a member has lost Medicaid, they can enroll in a qualified health plan. So let's say somebody was in that first May renewal cohort and they were determined ineligible, but they didn't at that time go out and choose a qualified health plan, then they can still now. And they just mark, all they have to do is mark on the form that they've lost Medicaid coverage. That's sufficient, and that will give them the ability to enroll during this special enrollment period. Of course, they don't have to do that right now with open enrollment, but it's still available for anybody that may want to access it. And I mentioned the advanced premium tax credit as a way to offset the cost of a premium. It really can make premiums zero or extremely low for individuals based on their income. And there's other financial assistance available too to help with cost sharing. So I always encourage folks to try to learn more about the options that are available to them on Connect for a qualified health plan. So these are just as of November 10th. We're tracking all the numbers. We're happy to see we've got a large number of members that are renewing. So that's great. And then lots of new members. So over 1,000 new members coming on. And again, that's just as of November 10th. So it's even grown more since then. So great to see the enrollment there increasing, and appreciative to everyone who's helping members find their way. We wanted to also take an opportunity. We're always looking for scams and making sure people are aware of them. If you hear of one, please reach out to us and let us know. We will do education on it. We'll post it on our social media, just trying to keep people alert and aware. So here are some great reasons, that you might see a potential scam. So certainly try to be buyer aware. And just always promoting our website. So has lots of information, has all of the CMS monthly reports on it, the demographic reports, all the flyers. Just a great way to stay up to date on what's going on, all things unwinding. And always promoting Facebook, Twitter, and Instagram. You don't have to do all three. If you could just do one, we share the same information across all the platforms. So if you could like us or follow us on one of them, we'd really appreciate it. You obviously know where you're aware of the stakeholder meetings, and we're going to continue these through the unwinding, and then those great reports for the providers through Kentucky Health Net and clocks. So I will stop presenting and happy to take any questions we may have.
Wonderful. Thank you so much, Veronica. That was very, very informative. We had a couple of things come in the chat. And then I did see on the registration, there were a couple of questions, but you provided a lot of information because a lot of those were about the Appendix K and some of those pieces. So I'll start with what we've got in the chat and one question from registration too. And then please feel free to keep sending them in. So the first would be about how many or about patients or members changing their Medicaid MCO in 2024 and sort of the process or how many times that can happen or what is the structure there since there's no open enrollment.
Yeah, I appreciate that question. And I will say that we are going to be sending out a communication in December to individuals, to members to let them know. And then, excuse me, any new member from that point forward will receive a separate communication once they're determined eligible. So if there's a new enrollee, they'll get a separate communication about MCO enrollment. So we did do away with open enrollment for 2024 for managed care organizations. That is just, again, it gets confusing, but that's just the opportunity for someone just to change their MCO without having to go through any other process. We normally have about 9,000 at the most actually change their managed care organization during an MCO open enrollment. And as part of the unwinding, we were concerned about people getting a notice about having to change their MCO and getting confused about their renewal. So that's why we made the decision to not have an open enrollment. So what can happen now is that a member can go out and change their MCO at any time without going through that extra process they had to do before outside of open enrollment. And they can change it multiple times. I think if we see a member switching frequently, we'll probably do outreach to that person to find out what's going on. It's not the best decision sometimes to change so much because part of the reason we have managed care organizations is so that they can help manage the care of the person. And if they're moving from MCO to MCO, then that makes that difficult. But certainly they can change it as much as they want to during that period of time. Great. We will, let me also note, so one of the things that does happen around MCO open enrollment is that we publish and post a value added benefit grid. And so that may already be posted. Apologize, I don't know that for certain, but it should be posted anytime now. And we'll make sure that members understand they could go look at that. And if something has changed with their current MCO in terms of what the value added benefit is, then, that may be a reason why they want to change their managed care organization.
Great. And then also, there was a question I was going to flag about. So if individuals are having issues with changing their MCO, how to reach out. And David Very put in helpful information to say that you all can call the contact center and the phone numbers there and look at, I believe he put in the value.
The link to the value added benefit grid.
Yes.
Oh, excellent.
Yes, I'm
thank
seeing
you, David,
DAB in that link. Yes, so that's exactly what it is. So thank you, David, for putting that in. But Joy, I do see your item about having trouble. So please go ahead and call into the contact center so they can assist with that.
Absolutely.
All right.
I will say, let me add, we're working on updating the self-service portal so members could utilize that to change their MCO. That has not gone live yet. So our system going live for making that change is next month. And so if you are having trouble, it's a manual process right now, and that may be why you're having some trouble.
Helpful to know. Okay, a question came in for members that are on LTC or waiver. Do they have to request the extension or is this automatic?
It's automatic for anyone who doesn't respond to a notice.
Thank you. Thank you for reconfirming. For outreach efforts to individuals who had their Medicaid renewal extended due to failure to respond, is there additional outreach going on? I know there's efforts and some paid media advertising going across the state right now. We are looking at that and updating and trying to get people to respond and come back and focus on getting within that 90-day window. So we're updating that. But anything else you would like to flag?
Yeah, we continue outreach for anybody that is being extended for additional time to respond to a notice, as well as somebody who has been terminated within that 90-day period. We do continue outreach. We do, and the managed care organizations do. And we try to prioritize them for that very reason that, we know they're going to either lose coverage or they have lost coverage.
Wonderful. Thank you. I don't see other questions coming in.
Helen, I think the only thing I want to mention is, so with all the strategies and flexibilities that we've implemented, we do have the flexibility tracker, but we're also amending our operational plan. We should have that posted soon. That updates all the things that we have changed over the past couple of months to keep that current. So you could watch for that posting too.
Great, that's very helpful. And then just verbally flagging David's response in the or David's added comment in the chat is that those members who have lost Medicaid and are eligible for QHP, they are getting some outreach from a contact center as well. So that is actively going on. We're giving we are tracking lists of members for calling, and agents and connectors are working on that across the board. So
yeah, I think the other thing, that we are trying to do, it's trying to figure out what's happening to them after they've been terminated from Medicaid and not either responding to a notice or moving over to QHP, because there's a gap between those numbers, and we're trying to get some insight into that. So we do track if somebody has commercial insurance on file with us. We call it third-party liability. So every month, as we for the people who are terminated, we're looking to see, do they have other coverage? And this is comprehensive coverage. So if it's just a dental plan or a vision plan, it doesn't count. But if we can see they have commercial coverage, probably through an employer, more than likely. But we are tracking that as well, just to again try to get some sense of who truly out there is uninsured that we need to be focusing on.
great. All right. Are there any other questions from the audience today or participants? Okay, I'm not seeing any else come through. So
Okay.
I want to thank you, new Deputy Commissioner, for taking time to speak with us today and share these updates. Again, it's very helpful to hear. Appreciate the data that's shared and just the transparency of sort of where the priorities are and what's going on. If there's any questions that you all have, you can we host this again in December, but we are happy to respond to information. I know everybody's got some ways of contacting our team. So please feel free to reach out, and we really appreciate spending the morning with us. So I hope everyone has a good rest of their Thursday and a lovely Thanksgiving holiday next week, as we won't have this group together next week. So
Yep.
thank
Happy
you all.
Thanksgiving, everyone. Thank you.